All right, let's just jump right into it. Today, we're diving into an eye-opening explainer that completely unpacks Dr. V.G. Gupta's clinical observations on male health. We're talking strictly about what's actually happening inside real medical clinics right now. No internet hype, no social media noise, just stripping away all those myths to look at the pure clinical reality. So let's kick things off by questioning that massive mountain of online health advice out there. Because honestly, what we're going to look at today might completely flip your perspective. We live in this wild era where literally anyone with a smartphone can call themselves a health expert. But how much of that is actually rooted in real science? As we go through the data today, I want you to ask yourself, where have you been getting your information?
Okay, to make sense of all this, here's our roadmap for today. Recovering the masturbation debate, the roots of modern infertility, understanding nightfall, the trap of fake doctors and magic pills, and finally, some actual steps to real recovery.
All right, Section 1, the masturbation debate, internet advice versus clinical reality. Let's get into it.
Now, what's really wild here is the massive gap between what influencers claim online and what highly trained doctors like Dr. Gupta are actually seeing in their clinics every single day. Online, you'll hear all the time that chronic masturbation is, totally safe, absolutely necessary, almost like a daily multivitamin. But clinically, well, Dr. Gupta notes it's literally the #1 reason young men are walking into his clinic dealing with severe erectile dysfunction, chronic fatigue, a total loss of sexual pleasure, and lower testosterone levels. The real-world clinical outcomes, they just do not match the internet hype at all.
And guys, here is where the myth-busting gets really fascinating. Whenever people argue for high-frequency habits, they almost always bring up this famous Harvard study, right? The one saying you need to ejaculate 21 times a month to prevent prostate cancer. But Dr. Gupta points out a totally glaring omission. That study, it was conducted on 50 to 55-year-old married men engaging in regular marital relations. Get this, the word masturbation is literally never mentioned in the entire study. No way, right? But the internet has completely twisted this specific science to justify a daily habit for young, unmarried guys. On top of that, Dr. Gupta provides some amazing historical context. He points out that ancient traditional texts are entirely devoid of this practice. I mean, if it was as essential as the internet claims, wouldn't it be in the Kama Sutra? Yet, it's not there. It's not prescribed in traditional Ayurveda either. Actually, Dr. Gupta links its modern explosion almost entirely to the 1920s Victorian era, and more specifically to the massive rise of visual pornography. We've literally taken a recent societal shift and falsely elevated it to some kind of biological necessity. Okay, moving right along to Section 2, the roots of modern infertility, a toxic environment.
So the data here is absolutely staggering. When newlywed couples visit fertility clinics today, a full 30% of them aren't just struggling to conceive, they are suffering from such severe modern impotence that they literally cannot even engage in intercourse. Just think about that for a second. The anxiety, the lifestyle factors, those chronic habits we were just talking about, they're causing major intimacy issues right at the very start of a marriage.
But it's not just our behavior, it's our environment. According to the doctor, our bodies are desperately trying to produce the cleanest, healthiest cells possible, but they're forced to do it in a profoundly toxic environment. Just look at what we're dealing with in major cities right now. We've got severe air pollution, veggies and fruits covered in pesticides, drinking water loaded with arsenic, adulterated food, and on top of the whole shebang, chronic stress from late-night work shifts that are just completely destroying our natural sleep cycles.
15 million. Let me put that number into perspective for you. The World Health Organization actually had to drastically lower the baseline for a normal sperm count. It used to be 50 million, but because of that toxic environment and those lifestyle factors we just talked about, they had to drop the normal baseline all the way down to just 15 million. Why? Because otherwise nearly 90% of the modern population would be classified as abnormal. That is a massive, massive clinical red flag for us.
Right, let's jump to Section 3. Understanding nightfall, demystifying the body. So Dr. Gupta clinically defines nightfall simply as the body's natural cleaning mechanism. That's it. Just like your body clears out other forms of waste, a healthy male body will naturally clear out old semen during REM sleep if there hasn't been any recent sexual activity. By defining it purely as a physiological function, we can just completely remove the stigma, the shame, and the fear from the whole equation. It's just biology, plain and simple. He draws a very clear, reassuring line for us here. If this happens, say 3 to 4 times a month, and you still have normal morning erections, That is a sign of perfectly healthy testosterone levels. It just means your body is working exactly like it's supposed to. But if it becomes this debilitating daily thing that ruins your sleep, causes physical weakness or burning sensations, well, that's a sign to seek treatment. And the really good news? It can usually be managed with simple things like Kegel exercises and really basic temporary medications.
Okay, Section 4, Fake Doctors and Magic Pills, the Quack Trap.
So here's the stark reality about medical regulation. In a lot of places, anyone, and I mean literally anyone, can just put up a sign and call themselves a sexologist because it's just not a strictly regulated medical title. If you want actual medical science, you need to see an andrologist or a urologist. These are the real doctors. We're talking 11 to 15 years of rigorous, highly specialized medical training, fully registered with the Medical Council. That's who you want to see.
And to highlight just how dangerous this lack of regulation is, combined with the intense social embarrassment around this topic, Dr. Gupta shares a truly shocking story. Listen to this. There was this highly educated, brilliant engineering graduate from IIT Kanpur, a guy working on the cutting edge of AI, who was so crippled by guilt and shame about his health that he completely avoided real doctors. Instead, he went to a fake Baba operating out of a tent and got scammed out of 6 lakh rupees. It really shows how self-guilt can totally override logic, right? It pushes guys right into the arms of criminals. And then, oh man, there are the online miracle cures. He exposes the whole magic pill scam for what it really is. Real medicine? It requires a diagnosis first. But these online pills, they promise to fix everything. Time, size, stamina, without ever even testing you. So what's actually in them? Well, published research shows they just take standard herbs like ashwagandha, crush up a super cheap 20 rupee allopathic drug like tadalafil or Viagra, mix it all together, and then sell it to you online at a massive markup of 2,000 rupees. You're literally paying a premium for cheap, hidden drugs and absolutely zero medical care.
All right, let's get into Section 5, Steps to Real Recovery, Dr. Gupta's Roadmap.
So, Dr. Gupta outlines this incredibly reassuring step-by-step process. Step 1, just break the cycle. Take a 15 to 20-day break from whatever negative behaviors are causing you anxiety. Step 2, fix your lifestyle. Get some proper sleep, eat better, and cut out the smoking and alcohol. And get this, he notes that just doing these first 2 steps actually resolves the issue for up to 90% of patients. That's huge. Now, if issues do persist, step 3 is getting basic blood tests, LFT, thyroid, testosterone, just to see what's actually going on under the hood. And finally, step 4, take those reports straight to a qualified andrologist.
The main takeaway here is honestly so hopeful. Genuine recovery requires finding the specific root cause, whether that's a hormonal imbalance, a blood supply issue, or just plain old chronic stress. Once a real doctor diagnoses that root cause, 90% of cases are completely cured with just 1 or 2 months of simple, inexpensive medication. This whole fear that you're going to need surgery or be hooked on incredibly expensive pills for the rest of your life, that is just another myth designed to keep you away from real doctors. So ultimately, it's time we deeply rethink where we're getting our health advice from. Are we really going to keep trusting algorithms, fake experts, and highly marketed magic pills? Or are we ready to finally step into the light of real clinical science and qualified medical professionals? If the clinical reality we unpacked today surprised you, just imagine who else might be suffering in silence right now because of terrible internet advice. Share this explainer with someone who needs a reality check, and let's start prioritizing clinical truth over social media hype. So what's it going to be? Thanks so much for exploring this with me today.